The next of our superficial sensation testing will be pain sensation testing, also known as sharp dull discrimination. Now, for testing purposes today, I'm going to use the tip of the reflex hammer that has a little pin, so you can use the one tip for sharp and the other tip for dull. You can also use a paper clip or, of course, a safety pin. Now, keep in mind you are poking your patient with something sharp, so not only do you want to clean any apparatus applied to your patient's skin, but you want to be mindful and be gentle with the sharp ends. So actually what we're going to be doing for pressure purposes is keeping our pressure on the pin. One way to maintain consistency of pressure is to keep the pressure light enough that your fingers can actually slide down the pin when you are applying the sharp pressure. So as applied to a patient, you of course educate your patient what she will feel. We're going to demonstrate on the uninvolved extremity. For the sharp end, I'm going to maintain enough, the pressure light enough that my fingers can slide down there, but you do not want your fingers to make contact with the patient's skin, because that is applying an abnormal tactile sensation and could mar the findings of the test. So what we're going to do is just slide down about to there. So what you'll be feeling, Miss Smith, we're going to be applying a dull pressure. You identify when I put pressure as either dull or sharp.
Okay.
We okay?
Okay.
The dull end, you do not want to create a cavern in your patient's flesh, just enough pressure to dent the skin. Okay? So this is what I'll be doing on your involved extremity.
Okay.
We always want to prop up, as previously noted, clear the area. We're treating in with superficial sensation testing. We are treating in dermatomal and or cutaneous nerve pathways. Never forget to have your patient close the eyes. If you do forget, or the patient instinctively does so, you must identify that you have asked your patient to close eyes before the sensation testing begins. All right, please close your eyes for me. All right, how about here? Is that sharp or dull?
Dull.
And here?
Dull.
Here?
Sharp.
How about now? And again?
I didn't get that one.
And now?
Dull. Sharp. Sharp.
And here?
Sharp.
Here?
Dull. Sharp. 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 Dull.
Thank you. Notice that in the areas that indicated a potential impairment in sensation, to distinguish between sharp, dull, we tested an extra 2 times in each area where she indicated an improper response to the test, just to be sure it wasn't tester area error, or to determine whether there really was an impairment in sensory feedback. Thank you, ma'am.
You're welcome.